Hi everyone, I'm Ian Harvey, massage therapist. This is my friend Rachel.
What's up?
You remember Rachel. Today we're going to be talking about anterior knee pain. Last time we talked about posterior knee pain. If you'd like to see that video, you can click up in the corner if I ever get around to annotating my videos. If you get a client in your office who talks about anterior knee pain, find out where exactly they're feeling it. Rachel has knee pain distal to the patella. So it's down here near the insertion site at the tibial tuberosity and out to the sides a bit. Sometimes you'll have more lateral pain, sometimes more medial. If you're having a client with lateral pain, I want you to also be thinking of the IT band. And about the things that attach to that, I'll have another video on just IT issues. If they're having more medial pain, I want you to be thinking about, of course, these quadriceps muscles, but also about these adductors and our little friend sartorius here. But if it just feels like it's on the front or feels like it's deep to the patella, then what I'm thinking is referred pain from the quadriceps. And pain from up here can also refer into the knee joint itself. If I hear about a client who says it feels like it's in my knee, I'm thinking gastrocs and I'm thinking quadriceps. But if it seems more anterior, then I'm thinking all of this. So first, let's start with a nice warm-up stroke. We're coming at this from a myofascial perspective. So my pressure is down toward the femur, but it's also up toward the head of the table. So think about 45 degrees. And I know I started that right around the knee joint, but I'll show you how you can start a little bit lower than that. And I'm going to be going all the way up to the ASIS, the anterior superior iliac spine, because I'm thinking origin to insertion and beyond, not just the muscles. I'm thinking of the fascia. So how can we include this tissue around the sides of the knee? Well, I'm just going to engage the tissue. It'll make your client's leg kick out just a bit. And then I'm going to scoop northward. So up proximally. I'm working with the fascia that's lateral and medial here. And I can target the front line a bit better if instead of doing fists out to the side like that, I have one fist trailing after the other. I'm still engaging this tissue just above the patella. I'm not putting any pressure on the patella because that's not fun, but just proximal to it. And right now I'm following the course of rectus femoris. If I get a client with pain that feels like it's under the patella, my first suspect is rectus femoris. Studies have shown that if this particular quadriceps muscle gets overworked, it can be associated with knee pain, and any isolation movement, including leg extensions, or even leg presses where you're kind of locked into place on a machine, can cause a bit of hyper-recruitment of that rectus femoris. So once you've worked with some broad sheets of fascia for a while, you can get into more specific work with rectus femoris. As long as you're between the patella and the ASIS, you're on rectus femoris. You can try to find the sides. You can, of course, do some nice differentiation here, or you can work directly on the muscle itself. You can look for trigger points here, see if there are any that refer down toward the knee. But this isn't my prime suspect in today's case of knee pain. because she's experiencing it down on the tibia, just proximal to the tibial tuberosity and out to either side. My main suspects here are vastus lateralis and vastus medialis. And those are two other places where you can do some nice trigger point work. If there are going to be trigger points here, they're very likely to be here or here. So in the biggest, meatiest parts of these muscles. So when you're working with these, communicate with your client and see if anything is radiating downwards. And I would continue this up a ways just to make sure that there aren't any trigger points further up. And I'll repeat that on the medial aspect. And vastus medialis will track up along with the femur. So if I were to stay medial here, I would be working with adductors. But instead, I want to follow the femur and come up with it. Some nice myofascial holds for the knee are to use a duck grip and scoop up everything around and proximal to the patella. I could hold that for a while, wait for it to soften between my fingers and thumbs, and then repeat it around the patella itself. And I'm coming out to either side, so I'm coming out to the top and the bottom of the patella. I don't want to interact with the patella itself too much. I don't want to put any pressure down onto the bone itself. And I'm not really interested in mobilizing it to the left and right. Although if you want to do so, you would bring the knee into full extension. And then that will slacken the ligament and the tendon, and you'll be able to move the patella about a bit. Now, you may be tempted when working with anterior knee pain, or pain that feels like it's in the joint itself, to work with that joint, to work with all these ligaments and aponeuroses and whatnot that live around the knee here. And you certainly can. Just realize that it's very likely that this is being broadcast from up here. So certainly work with the areas of pain themselves. You can work with this patellar ligament here, spreading that fascia. You can work with all of these ligaments around the knee. I'm not going to be trying to break up any scar tissue or anything like that. I'm more interested in providing some traction to the fascia and then allowing it to do the work. And of course you can do some nice spreading moves for this fascia here by using paired palms. If this isn't comfortable for your wrist, you can use knuckles here. Just make sure to come out all the way to the side. Something that can be nice for clients who are having pain up through the quadriceps or down into the knee can be to work with the quads in a lengthened state. And I would do this first by taking control of the drape, because I'm going to be bringing this leg out laterally and let it hang off the edge there and then redrape. And now you can work with that knee as before, or you can work one-handed and manipulate the low leg. So I'm doing kind of a pin and stretch here. As I get up toward the more proximal region of the femur, I'm going to come out laterally. I don't want to stay too medial there. Just some final notes. Don't forget about the IT band. We'll talk about that more in another video. Don't forget about the area near the ASIS up here. This is where the rectus femoris originates from. And try not to focus too much on the knee joint itself. While you can definitely make some progress by doing some friction around the joint and around the patella, you might get more bang for your buck if you're working up with quadriceps. Okay, let me know how this goes. Leave me comments, questions, suggestions. Consider subscribing, and I'll see you next time.